Incident Management Systems, or IMS series. And so thank you all for rejoining us or joining us for the first time, if that's the case. And we look forward to continuing to engage with everyone through these informative webinars. Just a quick update to say that unfortunately there's no translation service available today. We normally have one for French translation, but it's unavailable today. So we apologise for the inconvenience, and we're working on bringing this capability back as soon as possible. So you can submit your questions and comments in the question and answer box as we go along, and there's a button for that in the bottom of your screen or the top of your screen, depending on how your Zoom is set up. And we'll be happy to address those questions during the Q&A portion, which will follow the presentation today. So if you've not already done so, we'd really encourage you to join the PHEOC Communities of Practice, which is on the Discord platform. And this is for continuous engagement with experts and professionals, and the link will be posted in the chat box shortly. This is where you can find all of the materials and presentations and recordings and the quizzes relating to all of the webinars that we have delivered. So the community of practice obviously is about learning, not just from the presenters at these webinars, but also from each other. So we would really encourage you to share your experiences relating to any of the Emergency Operations Centre topics that we've covered and public health emergency response with your fellow colleagues and practitioners, either in the chat box as we're going along today, or during the webinar, or on the Discord platform. So yeah, really encourage everyone to sort of try and start sharing some of those experiences and really try and draw out some of the learning as part of this community of practice. So as part of our ongoing evaluation and continued improvement of these webinars, after this session, you'll see a pop-up poll for you to fill in about the webinar. So your feedback is really, really important to us and helps us to continually improve these sessions as we go forward. So really encourage you to fill that in at the, it will pop up on your screen at the end of the session or towards the end of the session. The topic of today's session is about incident management systems, specifically the management function, and it's a continuation of last week's webinars. So if you haven't seen last week's webinar, I'd really encourage you to sign up to the Discord platform and go and look at the presentation. So before I hand over to Seneat, just a quick introduction. So Seneat works for the World Health Organization Regional Office for Africa as a technical officer for emergency operations centers within the WHO's Health Emergencies Programme. She leads the WHO's functions in implementation of public health emergency operations centers in the WHO African region. She proactively works with member states and all the relevant partners to coordinate establishment and operationalization of national PHEOC in the African region. She's been supporting member states in designing and equipping PHEOCs, developing plans and procedures for operations and capacity building and conducting simulation exercises. Currently, she's managing the WHO African region PHEOC known as the Strategic Health Operations Centre, and supports member states operationalise their PHEOC to support the management of the COVID-19 response and other events. So Seneat created the regional network of PHEOC in which national PHEOCs in the African region are members. So the network is instrumental in development of norms and standards, sharing of information, experiences and best practice among PHEOCs, and brought PHEOC partners together. She serves as the Secretariat of the WHO Global EOC Net and co-chair of the Policy, Plans and Procedures Working Group. She also manages the EOC of the WHO Regional Office for Africa in Brazzaville to effectively support management of public health emergencies in the African region. So we're really lucky to have Seneat with her and her wealth of experience in the PHEOC world. So I'll just now hand over to Seneat to do her presentation. Looks like we have lost Sanette off the call. Okay. I will just give Sanette a minute to rejoin the call. If that's okay with everybody, we will be with you shortly. So we've just had a message from Sanette to say she will, she got disconnected, so she's just trying to rejoin. Apologies for the delay. We will be with you. We'll get the presentation going shortly. In the meantime, if anyone has any questions or anything they want to share in the chat box with our community of practice, that would be really worthwhile whilst we're just waiting for Sanette to rejoin us. So has anyone got any experiences or anything, any sort of comments and things that they thought from last week's webinar that they might want to share, or questions and answers? I see. Okay, I think we have, I think we've got some hands up. So we're going to see if we can get people to ask questions whilst we're still waiting for Sanette to rejoin. Apologies for the delay. We're trying do some ad hoc community, really improving the community of practice here. So please bear with us whilst we just try and work our way through this. So I think Womi said there is some hands up. Is that people that want to ask questions? I think, Ariane, have we got any questions in the chat box? I'm trying to keep
Yes, there is a question. It is not related to the incident management system, but I would still reply here. And the question is, how far do we know if the South African variant of the virus has spread in Africa, as Somalia is witnessing a more deathly second wave of coronavirus infections? And for that, I would suggest to have a look at the WHO weekly epidemiological updates that also include some information on these variants of concern. And I could put the link in the chat box if you're interested, unless you have something to add to that, Emily.
No, nothing to add. That's great. Thank you, Ariane. Someone's asked for a background review. I'm not sure a background review on what, but I will also talk about, if I can find it, the what the series, this series is about is the sort of practical knowledge on the concepts and principles and the structure of incident management systems. We're looking at talking about operating efficiently within the incident management system, and the series is going to cover a range of topics. Obviously today's is around the management function, so the incident manager functions. That's just an overview of the topic. Have we got Seniet back yet? So I'll see if I can call on, but I can't unmute people. But I think I see Milatu. Apologies, my name pronunciations is very poor. Milatu Animo. If you have a question, Womi, I'm hoping you can unmute from your end because I can't do it from here. Excellent. Milatu? I think we have a few. Milatu,
I'm back.
able to speak? We have Seniet back.
Yes, sorry, I really apologize for what happened.
We were just trying to do some. We were trying to do some sharing and some questions and see if anyone had anything from last week. But as you're back, we'll carry on with the program for today and get started with the presentation.
Okay, I really apologize for what happened, all participants and panelists. So I start my presentation. Our today's topic is management on management function of the incident management system. So the objectives set for today is by the end of the webinar, you will be able to describe the roles and responsibilities of incident manager, define the differences between the roles of incident manager and EOC manager, because there is often a confusion between the two functions. So we'll make sure that you grasp the basic differences between the two, and describe the tasks to be accomplished by the incident manager and the management team. So we've seen this last week, the incident management system sections. We said we have 5 functions in the IMS, which is the management function, finance and admin, logistics, operations and plans. And like I said, we're going to cover the management function today. So in the management function, we have the safety officer, the safety and security, public information officer, and liaison officer. So we're going to see each and every one of them. So what's the role of the general role of the management function? It includes the strategic, operational, command and coordination. So it makes sure that a strategic, operational, and command and coordination activities are undertaken. And these include the assumption of overall responsibilities and providing leadership for the overall response. It also directs activities based on explicit authority, which is the establishing objectives. This is very important part of the response. When there is an emergency, we need to quickly define the objectives and strategies for response and prioritize. Prioritization is also a very key leadership role. And decision-making, leadership has a lot of decision-making involved into it. And the function also ensures coordination of communication. Okay, so the roles included in this function is the incident. We have the incident manager, we have the public information officer, we have the safety and security officer, and the liaison officer. So these are the main ones we have under management function. But as we described last week, IMS is scalable, flexible, and adaptable to the context. So we don't limit ourselves into this, only this, but they are, we may, it's also modular. So we may activate part of these functions or activate all of them and also expand to meet the need. Now we'll see the roles of incident manager and the differences between the incident manager and the EOC manager. Okay, here we've put, we've listed some of the key tasks to be accomplished by the incident manager. The first one being ensure the welfare and safety of responders. The IMS acts on the principles of ensuring the safety and security of the responders who fill different positions of the IMS. In the first place, the incident manager should ensure the IMS staff. So maintains the situation awareness in terms of security and provide regular information to the team. Also establish an appropriate staffing level for the IMS. So the incident manager in relation with the EOC manager is responsible for staffing the IMS. And also provides supervision to the IMS, the management function staff, the management section staff, and also all the general staff of the IMS, and provides leadership and guidance. And very importantly, the incident manager needs to provide specific tasks to be performed by all staff in the IMS. So ensures the incident manager ensures provision of specific tasks and assignments to be performed by the EOC, both the management staff and the general staff. The IAM also ensures incident action planning. So it's the responsibility, though the planning section is responsible for the collecting information and based on evidence drafting plans, but the responsibility to set objectives and oversee the planning and situation analysis of the plan is the responsibility of the incident manager. Also need to ensure regular situation analysis and continuous monitoring of operational effectiveness. The IAM also determines information needs for staff, partners, and stakeholders. And so regularly, the IAM ensures regular sharing of information with relevant stakeholders and maintains continuous situational awareness. So the incident manager needs to have an operational picture of the response by maintaining situational awareness. That means knowing what's going on about the incident. The IAM also ensures incident objectives are being implemented and also resolve any issue in the IMS, be it personal, be it operational, be it financial. So any challenge that the IMS staff are facing, he has the responsibility to solve issues. Also provide updates to the Minister of Health leadership. This is, the incident manager serves as a contact point between the incident management system, the IMS, and the policy group, which provides strategic direction to the incident management system. So there should be a regular information flow from the IMS to the leadership, which provides strategic guidance and direction to the incident management system. So the IAM need to set a regular mechanism for providing update to the leadership. Ensure health messaging is also very important. The incident manager should ensure relevant information is communicated to stakeholders and the media in a timely manner. So this is the tasks that are in general assigned to the incident manager, but as I said, these are always modifiable and adaptable to the context. And a specific timeline should be given to all the tasks when they need to perform this, and the time frame, as well as the frequency. If they are regular, we need to define the frequency of each task. Same way, when the incident manager provides tasks to the incident management team, need to perform the same kind of tasks with time-bound tasks to the incident management team, and ensure the accomplishment of each task by providing a tool called job action sheets. Now, when we activate our EOC and establish IMS, the first thing we need to do is establish the incident management system and staff the IMS. Once we staff the IMS, we need to bring the staff. So in the initial briefing, the EOC manager, as he knows the tools, the guidelines, and the procedures, protocols to be used in the EOC, need to accompany the incident manager in providing briefing to the staff. So these include situational assessment. So once the situation assessment is conducted, a briefing should be provided to the incident management system on the situation, results of the situation assessment. A clear response objectives need to be clearly communicated with the incident management team. Job responsibilities, I said this earlier, clearly defined job responsibilities and tasks should be provided to each and everyone in the IMS. And the defined operational period. We'll see this later on, what operational period is the period that you specify in which period specific objectives you need to achieve. So the operational period is defined based on the dynamics of the emergency. So the operational period should be clearly communicated to the EOC staff. Description of the response organogram. So once the IMS structure is set and staff are assigned to each position, then the description of the organogram need to be provided to the staff. Availability and provision of tools and guidelines. This is mainly the responsibility of the EOC manager. You know, we said last week, the tools and guidelines, as well as the plans and procedures, need to be prepared ahead of time and their functionality tested. So a guidance should be provided to the IMS staff, how they use and where they can find it and so on. Required safety procedures. So I said earlier, the incident manager has the responsibility to keep the work area. So we have in our EOC a working area. So the assignment of location and so on should be also provided during the briefing. Instructions for obtaining resources. Yeah, how the resources would flow to the EOC, make order, dispatch, and so on need also to be provided. Identification of break area. Yeah, you know, in the EOC, very often we advise to have a break area, so this needs to be communicated during the briefing. Okay, so apart from the initial briefing, the incident manager also needs to regularly communicate and hold briefings with the IMS staff. So some include reinforcement incident objectives and adjustment to response strategies. So once we set the objectives, depending on the dynamics of the emergency, we keep on adjusting our objectives and strategies. So all these adjustments need to be clearly communicated with the IMS staff. Provide summary of current organization. And if there is any change in the organization, need to be regularly communicated. Provide overview of current incident activities. Yeah. Activities can also change. We're going to see it later on. So a regular briefing should be provided as well. Establish time for daily update for leadership and provide regular updates to the IMS staff as well. So there should be a regularly set time and date in terms of providing updates to the leadership and to the IMS staff as well. So the IM is responsible for setting the rhythm of the staff in terms of organizing regular meetings where the IM provides updates and briefings. Establish parameters of resources request and release. This is also very important. Especially the logistics and admin finance need to know how, and those who are in the operations as well, how to make orders and all the procedures required for placing orders and so on. IMS tasks are scalable and flexible. Same way the IMS structure is scalable and flexible, same is true for the incident management tasks as well. So the tasks need to be regularly adjusted to the scale and complexity of the incidents. The IM is responsible for setting the response tempo and climate for the response. and set the staff written. I said this earlier, it's, the responsibility of the IAM to set the staff written, the regularity of tasks to be performed by the staff. The IAM will determine when and what meetings are necessary to ensure the coordination. So this is part of the setting the written. Okay. Establishing incidents, strategies and priorities. Yeah, at the beginning we said it's the responsibility of the incident manager to set objectives, strategies, and priorities. So it needs to follow the five-step. Sorry, this one is 5. I'll quickly. It includes 5 steps. The first one being setting the objectives. And the objectives need to be SMART, which means specific, measurable, achievable, relevant, and time-bound. So the IAM has the responsibility to set SMART objectives. Select an appropriate strategies. So it's also the responsibility of the IAM to set appropriate strategies to achieve the set objectives. Also direct the use of tactical resources. So it's the responsibility, of the IAM to allocate resources. Once we establish our incident action plan, based on the objectives, we set activities and strategies to achieve the objectives. So resources should be allocated based on priority setting. And create accountability and establish monitoring and evaluation mechanism. Okay, so these are the 5 steps: developing focused objectives, select strategies, allocating resources, creating accountability, evaluating outcomes. So this is done using incident action planning. And the incident action planning should have a defined operational period. And the circle repeats itself once we complete one operational period and we come again into setting or adjusting our objectives, and the cycle continues. So we usually follow principles of management by objective to achieve our objectives and implement our incident action plan. When we did the leadership series, we covered the management by objective. So you will find the presentations in the Discord platform under the leadership series. So incident action planning. I said incident action planning is the tool we use to perform the management by objective and accomplish the 5 steps of management by objective. So the IAM has the responsibility to review the incident action plan and ensure accuracy and completeness once the plan is prepared by the planning section, and verify objectives are incorporated and prioritized, which is ensure priority setting, and ensure objectives are well communicated with the IMS staff, and also ensure tasks and assigned into each and every periodic checking and evaluation through the IMS also need to be communicated effectively, ensure coordination with the objectives for the fulfillment of in our incident action planning. So the incident manager ensures involvement of every staff tasks. Okay, apart from implementing the incident action planning and setting goals, the ability and leadership provide leadership, which is the IMS relation among the staff. And if there is, if problem arises within ecosystem or kind of problem, coordination and negotiation is happening as well. So it requires, incident management leadership requires a lot of coordination, partnership, and negotiation. So these skills, and he has to have this. The IM also need to inspire and motivate responders. We all know that we work under circumstance full pressure, all the time inspire and motivate. Key leadership. So the IM need to regularly address the media, effectively communicate within the IMS, effectively communicate outside the IMS. It can be with the disaster management agency, with the leadership, with external stakeholders who are involved in the response. So communication is also another key function that the IM performs within as part of his leadership skills. Decision making. So decision making is very important in incident management, and the IM need to have that skill. This is very important because in managing emergencies, we make decisions every second, every minute. So these are the 7-step decision-making process, which include identifying the issue, gathering information, analyzing the evidence, developing options, evaluate the alternatives, choose the alternatives, and take action. So we recommend that this decision-making process are followed, and every IM need to be equipped with these skills. So who appoints the incident manager and how the incident manager is appointed? The incident manager is appointed and oftentimes I think we need to have the list of potential incident managers in our roster, but the responsibility for designating incident manager should be authority. It can be the Minister of Health, Chief Medical Officer, Director General, and so on. But our selection process also need to depend on the procedures we have set and the authority we have designated in our legal framework. This is the advantage of having a legal framework. Once we have an emergency, we know who is responsible for designating an incident manager. And the tasks to be performed by incident manager, a general tasks need to be outlined in our legal framework and in our plans and procedures in the EOC as well. Okay, now we'll see the differences between incident manager and the EOC manager. So these are very often confusing, and the people are do not really know what the differences are. So the incident manager, the basic difference is the incident manager is a temporary position and the EOC manager is a permanent position. The EOC manager is designated when there is an emergency to manage the emergency for a given period of time. You know, it can be during the once we have an emergency until the emergency is completely ended. We may have one incident manager, but the EOC manager is there during all phases of emergencies, the permanent EOC staff. The incident manager is responsible for managing incident, but the EOC manager is responsible for managing the emergency operations center. The IM has the delegation of authority and responsible for situation reporting to the senior leadership. This we have described all. But when it comes to the EOC manager, monitors overall effectiveness of the preparedness and response activities in the EOC and coordinates the watch mode activities. So these are the differences. Can an EOC manager be an incident manager? Yes. It all depends on the authority. If they believe the EOC manager has all the skills that we described earlier, the leadership and taking responsibility to be the incident manager. But the incident manager, the EOC manager, becomes an incident manager for that period of time. Once the emergency is ended, is back to his normal EOC manager position.
Sania, can I just time check just to let you know. We'll stretch into 5 more minutes just because we had a delay at the start. So if we could sort of speed up and 5 more minutes.
Do I have 15 minutes?
5.
5 minutes. Okay.
5 minutes,
okay.
And then we've got quite a few questions, so that's good.
Okay, 5 minutes is okay. So the responsibility of the EOC manager is ensure the day-to-day operation of the EOC and prepares all the plans and procedures and tests their functionalities and monitors the functions of the watch services. And during an emergency, supports the EOC manager, serves as an advisor to the EOC manager and avails all the resources available in the EOC. So these are the roles and responsibilities of EOC manager during the two phases. So we've seen the public information. I will not spend time on this one. We're going to have a dedicated session for public information towards the end of the series. But the general responsibility of the public information officer is to advise the manager on communication, and how provide advice on media relations. It serves as an interface and with the media, the public, and different stakeholders, and obtains information across the incident management system and produces information products and prepares press release and scan the media, monitors the media and updates and provides information to the incident manager and the IMS staff as well. But we are going to have a dedicated session on public information. Liaison partnership. The liaison or partnership officer is responsible for maintaining contact between the EOC and the external stakeholders. Also maintains contact between the EOC and the disaster management agency, and ensures coordination between these entities. So the liaison or partnership officer is responsible mainly for maintaining contact, ensure information flow between stakeholders, external stakeholders, and the EOC. Information is regularly communicated with them and ensures coordination, and external stakeholders is monitored regularly. And also provides regular security and safety update to responders. Also provide guidance on the psychological and emotional challenges. When there is an emergency, especially for the tactical level responders, they face a lot of challenges, and they are affected psychologically by the day-to-day challenges they face. So it's very important that the safety and security officer ensures support is provided to the EOC staff, and provide advice to the incident manager on issues regarding safety as well. So in summary, this is my last slide. The incident manager is responsible for the overall response to the emergency, but the EOC manager is responsible for preparing the EOC for emergency response, and provide support and serves as an advisor to the EOC, to the incident manager. The liaison officer is responsible for maintaining contacts between the EOC and the stakeholders, and the communication officer is responsible for the overall communication from the EOC and from and to the EOC. and safety and security officers ensure response staff safety and security. So this is the summary. And here you have the guidance for developing the EOC, Part A, policy plans and procedures, Part B, physical structures, technology and information, and Part C, training and exercise. So the Part A and Part C, they have been published already, and they are in the WHO website, and the Part B is in process of publication. And thank you very much for your attention. Over to you, Emily.
Great, thank you so much, Senia. Really, really good presentation there, and some really good detail in that incident management and really the incident manager role, as well as various other of the management roles within the EOC. I like that talking about the importance of those initial briefings and the irregular sort of staff updates. I think that's a really important aspect of the incident manager role, and just making sure that everybody's really kind of knows what they're doing and what the expectations are and what the response will actually look like. I like the bit on sort of providing the leadership and really kind of some of those skills in the leadership element of incident management are really difficult to teach. So it's quite key there in kind of choosing and assigning those incident managers, because you can teach some of the things, but some of those more soft skills are difficult to actually teach. So some people will have them naturally, and those are the sort of people that you want to look for, your leaders within your organizations. And the sort of importance of that decision-making, simple step-by-step decision-making process, but I guess in reality and actually putting that into practice, it's undoubtedly a lot more difficult than it seems. But having a clear sort of step-by-step process makes that it all goes towards helping to make those good decisions. Yeah, so the importance of obviously appointing your incident manager, and because that's giving them authority and accountability for the response, which is a big role. So thank you loads for the presentation, Senia. It was really, really good. We've got we've got lots of questions from
the IM, the EOC staff and the incident management staff be assembled. I said the EOC staff are permanent, and the IMS staff are not permanent. They are there until the emergency, during the course of the emergency. So the EOC staff, they are always there. In last week's presentation, we covered who should be the EOC staff. So we provided minimum requirement for EOC staff, which include EOC manager, operations officer, planning and information, admin and finance, and logistics. So the EOC need to have this minimum staff. So these are always there. But the IMS staff, they are temporary. And who should staff them? It all depends on the type of emergency. So the EOC is an all-hazard EOC. So we need to have, in this case, rostering is very important. We need to have all multi-sectoral, multidisciplinary staff in our roster. So when we have an emergency, we draw our expertise across different sectors and different disciplines. So this is how we staff our EOC. So yes, they should be drawn from different sectors and different disciplines based on the context. But the most important is rostering. We need to have ahead of time our roster ready, and those who are in the roster need to be trained on their functions. and they need to exercise their functions as well. Then when there is an emergency, they come and staff and perform the function easily.
Great, thank you.
Over to you.
Ariane, did you want to do the next question?
Yes, with pleasure. So the next question, Sinead, was that in some literature, the incident management system is described as something modular. What exactly does this mean?
Okay, thank you. I think we described this in our last week's presentation. Yes, IMS need to be modular, and it means it can be activated at a very smaller scale, and some only part of the IMS is activated. I remember I gave an example of communication last week. If there is an issue with communication, we activate the IMS, but we don't activate the entire IMS. We only activate the communications, because there is something that the communications, under the management function, the communication need to address. So to address this issue, only this one is communicated. So it doesn't mean when we activate the EOC, every section is activated. And when there is a need, we activate all the functions. If there is no need to activate, for example, the information management, for example, and there is a need only to deploy resources, and there is a need for communication and the setting up operations in the field, we activate partially the different sections. And when there is a need also, we expand the IMS. We also include more functions under different sections, and this way it's scalable. So this is what it means, modularity. So an IMS must be modular.
Thank you, Sania. Yeah, I was going to say, I would say the same. It just allows that sort of focus in certain areas, and allows you to sort of group your subject matter experts, for instance, that are going to focus on a particular area of the response. And and as Sania said, it's really important that it is modular, so that you don't have to have all of your IMS activated if you only need certain parts of it activated. Yes. Okay, so next question then. So how does the incident manager determine information needs for stakeholders, and what are some of its?
Yeah, I said, some of the skills the EOC, the incident manager, needs to be equipped with the environmental scanning. So he needs to be regularly scanning the environment within the IMS, but also within the stakeholders. So this way he identifies the requirement. The information officer is also responsible for defining the requirement. Then, depending on the stakeholders' need, then the information management team develop communication, then the prepares communication, then the communications officer communicates the information needs of the stakeholders.
Great, thank you, Sonia. I was going to add there as well that some of that, your information needs from your stakeholders can also be established at the sort of planning, when you're doing sort of joint planning for the response. If you do sort of multi-sector planning and multi-organizations, you can find out some of what those information needs, what do those other organizations need during their response in order to improve that coordination. So yeah, just wanted to add that bit in. Ariane, did you want to do the next question?
Yes, with pleasure. The next question pertains to training, and there's two parts of it. So first of all, the scenario where, for example, the assigned incident manager has no training on the incident management system. The question is whether there's a possibility to provide them with IMS training, or what options there are before they assume their responsibilities. And I'll add the second question also related to training, where the question is, how can we convince countries to assign someone with IMS training into the position of incident manager?
Can you repeat the second question?
Of course, the second one is how can we make sure, how can we lobby for the decision of nominating the incident manager, that this is a person who has actually been trained on the incident management system?
Okay. I think this is very crucial, and this is what WHO and stakeholders are advocating, because the leadership skills for incident manager are very important. You cannot just appoint anyone who doesn't have skills for managing incident management, and also knowledge how the incident management system operates. So that's why we emphasize rostering, including incident managers, is very important. So as much as possible, incident managers, list of potential incident, an EOC should have a list of potential incident managers, and with potential skills of leadership. But we see in some countries that EOC managers are appointed, and incident managers are appointed, but they don't even know how the IMS operates. So in this case, personally, I would advise the EOC manager plays a crucial role in supporting the incident manager, in providing briefing, in allowing him to take through the different policy plans, procedures that are in the EOC to support, and also even providing briefings on the IMS, how it should function, the communication plan available in the EOC to support internal communication within the IMS, also how to communicate externally with stakeholders and so on. So I think the EOC manager plays a crucial role in providing support in scenarios where an incident manager is appointed by the authority to perform, to lead an emergency response.
Thank you, Sonia. I think that's quite a common challenge, I think, in the incident response. I know sometimes as well, often it's people want to assign their sort of subject matter experts as the incident manager, and then because because they know the most about whatever the type of incident or emergency it is. But actually the incident manager doesn't really have a huge amount of time to be the subject matter expert, and their time should be spent steering the incident and leading everybody, for which knowledge in IMS is probably more valuable than the subject matter experts. You can leave the subject matter experts to be part of your IMS, the people that are actually able to have the time to respond and look at those response interventions. So yeah, so that's quite a common challenge, I think, across the board. I think we've not got a huge amount more questions, but I'll just do one more question from the list, and then all of the other questions, Sene, if you're okay, we'll pull these off of the Zoom, and then send them to you if you're able to sort of give some answers, that we can post them onto Discord. But the next question then, the last question is, how can we achieve accountability in IMS?
Accountability, yes. I think accountability is important, very important thing to in our incident management system. Before I answer this question, I would like to emphasize, all the leadership series to revisit. They are all in the Discord, and we covered when we did the leadership, we covered the accountability as well in a detailed manner. So one of the mechanisms for creating accountability in incident management is the task management and provision of job action sheets. So this way, the incident manager is, every individual in the IMS is responsible for a specific task. So once a job action sheet is provided to the individual, so each individual is responsible and accountable for the tasks listed and this need to be regularly updated by the incident manager. And our incident action plan need to be regularly monitored using task management. So each and every EOC need to have a task management tool. And the task management tool, every activity in the incident action plan, there is a responsible person and a specific time frame for delivering each activity. So, the individuals assigned to each and every activity, they are also responsible for delivering the activities. And when we do the evaluation at every end of operational period, we conduct evaluation. Then during this evaluation, all the gaps and issues and challenges are addressed in the next operational period. Another thing is the overall monitoring and evaluation framework, which include specific indicators for monitoring response. So these indicators also provide overall accountability for the incident management system. Thank you. Over to you.
Great. Thank you so much, Sonia. Some really great answers there. Okay, so I think that brings us to the end of our webinar. So next week we'll continue with the series focused on incident management systems. So we really look forward to you joining us. As mentioned at the beginning, if you've not already done so, we'd encourage you to join the PHEOC communities of practice on the Discord. We've posted the link to Discord a few times in the chat box. So if you could, if you still need the link, then please do let us know, but it is in the chat if people can find it. We'll also be utilising there'll be a quiz that will be posted after the last session in this series to continue the learning and sort of serve as a bit of a knowledge check of the information that we've presented. Once the quiz is live, once you've answered the quiz and completed the quiz, you will receive a certificate to part in these webinar series and completed all of the series. You'll also have seen that the pop-up poll hopefully popped up on your screen just before at the end of the presentation. So I really encourage you, as I said before, to complete it if you haven't already done so. The feedback really helps us to continually improve these sessions, which we want to keep doing, obviously. So I just want to say a big thank you to Seniat and Ariane for your support and for the brilliant presentations today, and for the lively participation in the Q&A session. We're looking forward to everyone joining us next week for the next session, and we hope everyone has a great morning or afternoon or evening, depending on where you are joining us from. So, thanks again, and we'll see you next time. Everyone.
Thank you very much, Emily. Bye-bye.
Bye.
Bye-bye.